Across the country, seeing a rise in children with RSV.
Yeah, doctors are worrying that the winter months could prove challenging with more cases of RSV, the flu, and COVID.
Joining us now to talk about this is Dr. Sally Permar, Chair of Pediatrics at Weill Cornell Medicine and New York Presbyterian Kamansky Children's Hospital. Dr. Permar, welcome. And we understand that Pfizer is now working on an RSV vaccine for newborns. Where does that stand right now?
Yes, there were some exciting results just yesterday that actually a maternal vaccination worked well to prevent hospitalization of children with RSV. And that's exciting news as pediatricians because this is a virus that we see affecting our newborns, young infants every year, and it's one of the major reasons for hospitalization.
And it's actually very scary. I mean, to see this nation and New York City, right here in New York City, seeing these numbers spike due to, the Omicron wave in 2021. This is the highest since then. Is there any concern about hospital capacity in New York City? Because you've heard, Connecticut and other places, other parts of the country are dealing with such an overburdening of the hospital system right now.
Yeah, the volumes are very high for children needing care for respiratory diseases. And it is something that in the last couple years, we had fewer children overall with needing those types of services because for reasons that are still surprising, COVID did not affect children as severely as adults. But now we're seeing the comeback of typical respiratory viruses that are coming back into more normal circulation, and our children are needing those services again. We are managing the volume, but it is requiring us to look at places we can increase beds, to increase our staffing where we can in order to serve those children in need.
And for adults who are visiting somebody who has a newborn at home, are there certain vaccines they have to have? Now, I was just told to visit my soon-to-give-birth niece's newborn baby, if you could follow that. I need to have an updated flu shot and Tdap. So that's the tetanus, pertussis, and what's the other in the letters there? Tetanus, pertussis, and diphtheria.
Diphtheria.
So is there a resurgence in those diseases, specifically whooping cough, pertussis?
Yes, well, the strategy you're talking about does work very well, which is to cocoon the baby with adults who are vaccinated for the things that we have vaccines against that may affect the baby. So like you said, pertussis is something that can be very severe in babies, yet we have a vaccine for it. And while children don't respond right away to that vaccine when they're born, the adults do. And so the recommendation is to make sure you're up to date for your Tdap, for your flu vaccine, and your COVID vaccine as well.
Gotcha.
And speaking of vaccines, some parents just feel so beat down by this, just this insurgence of all these illnesses that just keep happening over and over again, cycling through the whole household. What can we do? So let's talk about the vaccines that are available and other means of keeping our kids, healthy.
Yeah, we want to keep our kids in school and in their normal activities because we learned how important that was through COVID. But yes, so this is the season for getting your flu shot if you haven't done that yet, children down to age 6 months, as well as your COVID vaccine, and including, again, down to age 6 months. So make sure you're up to date for all of those. And then the routine vaccines, which are things that your pediatrician is always keeping you on schedule for. So make sure that your children are up to date for those. Other things are hand washing, always an important way to help prevent the spread of germs. And if you really don't want those respiratory viruses in your household, even wearing masks. So children, masks are optional generally in schools, but they do work to prevent respiratory infections. So especially if you have someone who's at higher risk at home, it may be a time to reinstitute those masks.
And what are some other ways that we can just kind of not overburden hospitals right now? What are the choices for parents? Because, they're deciding, okay, something's wrong with my kid. There's the thought of the ER, there's the thought of the pediatrician, and there's the thought of just staying home and managing. How do parents decipher through that right now?
Yes, it is something as a parent that if you are concerned about your child, things that you can look for in your child to know if they're having issues with respiratory infection that could need higher level care is breathing fast, the tugging between their skin, in between their ribs, not able to drink, not urinating in more than 6 to 8 hours. Those are concerning signs. You should always contact your pediatrician who deals with these a lot and knows sort of when to send children to a higher level of care. And then if your child has routine medications, especially for asthma, to make sure that those are maintained and that your child is compliant with those. So those are ways you can try to keep your child from out of the ER and out of a hospital bed.
All right, so when in doubt, call the pediatrician.
There you go.
Good
Yes.
advice.